is Cindy Havlin. I'm from Community Care Network. Thank you for joining us today. March is Developmental Disability Month. I would like to introduce you to the people on our panel. To the right of me is Kristen Brogan. She is the quality manager. To the left of me is Josh Williams. He is our placement manager. And to the left of Josh is Lori Mesley. She is a shared living provider. Kristen, can you tell us why we're here today?
Sure. I'm going to talk a little bit about developmental services through Community Care Network. Also highlight a little bit about the Developmental Disabilities Awareness Month. And we want to give a little bit of an overview about our shared living program. So first, I'll talk about Community Care Network. So Community Care Network is comprised of Rutland Mental Health Services and Rutland Community Partners, community programs, You may be familiar with behavioral health services, developmental services, substance use recovery services, senior and volunteer programs, early childhood services, and our volunteer programs. We are from Developmental Services. Within Community Care Network itself, we serve about 3,000 people within Rutland County. The Developmental Services program, we serve about 450 people. We provide a lot of services. We start anywhere from zero, from birth to, we have a client right now that's almost 90. We do early childhood program with our bridge team, bridge care coordinators. They provide case management services, and they do some check-ins. They help with IEP development for kids that are in school. We do flexible family funding services, which helps with respite and trying to provide some activities for kiddos. We also link to Children's Personal Care Services, which is through the state of Vermont. After the Bridge program, we have Developmental Services. Developmental Services is for adults. And again, we work with adults through their lifespan. We can have an individual on our caseload for their entire life. The individuals that we serve right now, they primarily get services under the home and community-based programs. So that includes our employment services, our community support services, shared living program, which we're going to talk about a little bit later, and we also provide some respite services. Developmental Disabilities Services it's kind of it encompasses as a whole, and it's a pretty big program. So I'm just giving you guys a brief overview of what we do. I can go into more detail a little bit later, but we really wanted to talk about Developmental Disabilities Awareness Month. The work that we do with our individuals is really pretty profound, and I just wanted to acknowledge the growth and how much our individuals give back to our community. They really enrich our lives, and they make our jobs really fun, and without our individuals, we wouldn't be here right now. Some of the things that they do is help and give back to our community, such as volunteering. We have a lot of people that enjoy volunteering, like they love to go to the Humane Society. We have a lot of folks that do equine therapy, and they help with the horses. We have individuals that help at the food cupboard and the community cupboard. They just really like to give back in any way that they can. So we try to encourage the growth and development as much as we can. But we provide a range of services. The shared living program is one of the ones that I love the most, because when I started in developmental services, I've been here for about 9 years, and when I started, we had an individual on my caseload that had been in there for 38 years. And that was probably the longest shared living home that we had at that time. But that individual had left the Brandon Training School and went straight into shared living. And it was pretty amazing to see the growth that they had done in that short period of time. Josh, do you want to go over the shared living program?
Sure. So the shared living program, basically, it's opening your home to an individual and just helping them with their day-to-day task. Anything from hygiene to money skills, budgeting, shopping, things like that. Making sure that you work closely with the team. You know, there's a team process. It's You have a service coordinator. A lot of individuals have a state-appointed guardian. Some of them don't have a state-appointed guardian. But basically, to become a shared living provider, you got to be 21 years of age. And we have some trainings. It's pre-service, in-service, and CPR certified first aid. Really, what shared living to me, I grew up in shared living. My mom's been a provider for almost 30 years now. My wife and I have been providers for, I want to say 13 or 14 now. Basically, I would say be open-minded. It's really making sure that our individuals are living the life that they want to live. We have things in process, person-centered planning, ISA, individual support agreement is what that's called. And it really does help paint a picture of what the life is that an individual wants to live and what their goals may be. And that's where the shared living provider really does play a huge role in it. Just helping them with their day-to-day, making sure that their voice is heard. There's monthly meetings with the team. We actually have a shared living provider here today, Lori Mesley. And, we're kind of just going to have a little discussion, just talk about, what does a day in the life of a shared living provider kind of look like. I would say 80% of the time, it's fun. But, there is those times where and the three main things I feel that you could kind of really find yourself really supporting an individual in is budgeting money, food, and hygiene. I'm not sure what you want to add to that. Like, what's a day look like for you?
Well, I would correct you. I would say 90% of the time, it's pretty good. It fits very well into your life. 10% of the time is the time that you really tap into your team. And I can't stress enough how important it is that even though I am a shared home provider and I'm the person that does 90% of the work, they do 90% of the paperwork. I do the trench work. It's very gratifying, and when you talk about disabilities and people and individuals that need living supports, I've done 6 individuals, 5 women and 1 young man. So I've had quite a variety of experiences, and I would say that each one of them is a completely different experience. It's good in their own ways, and the difficulties, again, that I'm going to back that up to the teamwork. It's really important if you choose to do something like this, that your team understands what your skills are, in addition to what the developmentally where your individual is and what your needs are. And I find that it has been across the board a very positive experience, and it's one of those jobs or experiences that you get to see the results, and it's really a great thing to be a part of.
Yeah, I agree. It's something that's rewarding at the end of the day, especially if you work with them and they start making those little changes, and then they see the results, and then they just go with it, and then it just becomes a way of life. And I've been all over the world with my individuals, just enjoying the fruits of life as much as we can. But they're not afraid to get down, and a lot of them have jobs. Some of them work 20 plus. Some work 40 hours a week. And it really is a good way to live, is the best way to really say it.
Josh, do you think you could tell us the difference between emergency respite and a shared living provider?
Yeah, so what we have is emergency respite. Basically, that's where I would come in and try to find, I have a list of some new applicants or shared living providers who may have an extra room, and they basically support us if there was the loss of life of a caregiver, or a person's goals may have changed and it doesn't quite fit the dynamic of the household. Things like that. Shared living providers retire, illness. And so I have probably 3 or 4 shared living providers who really only do just emergency respite for me. And emergency respite can be anywhere from a couple of days to a couple of months. A lot of times, if you become a shared living provider and you're waiting for a placement, it might come to you as emergency respite, and the goal is to hopefully turn that into a permanent placement. So usually, I try to keep it within 2 weeks. Like if it's not a good fit within 2 weeks, usually it's time to try to find a different placement. I am currently looking for some people who may just want to do just emergency respite. The thing with emergency respite is it's not a guaranteed thing. It's really as I need it. Sometimes also what we run into for emergency respite is a shared living provider has a respite provider. They had a week's vacation plan, but then the respite provider got sick. That's where I might be giving you some phone calls. Hey, they want to go on this vacation. We need some support. In shared living provider, the difference between that is you'll actually have a year-to-year contract signed. And yeah, that's pretty much the difference. Is emergency respite is as needed, and shared living is kind of, you're locked in.
Could you also tell us what kind of person would be the ideal person to do emergency respite or shared living provider?
I would say somebody who is open-minded and understands that not everybody is the same, and what their views might not be the same as the other person's views, and just have a good work ethic yourself, I would say, good values. I wish I had some younger generation shared living providers, I would say. Maybe some single males out there who have an apartment with an extra room, and they're looking to do something to support some, because we have it's 18 and up. So, we have some young males who are trying to, they may not want to live just in a family setting. They might want to have more of a roommate type setting. So yeah, that's what I would say.
Okay. Could you tell our audience if they were interested in becoming emergency respite or shared living provider, who would they contact, and what would it entail?
So if you you'd have to fill out our application, which we have available. And I would basically, once I receive your application, we would do a background check. And then from there, I would send you a pre-service training, which is, we used to do them in-house, but it's really PowerPoint and some videos with a review at the end. And then from there, just kind of learning a little bit about what your lifestyle is, things like that. I try to really make sure when I make a placement that it's going to be long-term. I don't really want to bounce individuals around too much or anything like that. But then from there, it's really, I'll come out to the house. check it out, check the room, make sure it's up to code. We do inspections. It's really just the Vermont State Fire Code inspection, smoke alarms in rooms, chimney cleanings, water test, egress window size has to be correct, fire escape plans, fire extinguishers in the right areas. Yeah.
Okay. How do you, what would be the contact information? Just to call up Community Care Network and?
Yeah, we have the phone and we have the website. And then from there, you would probably end up in contact with me, most likely. I'm open anywhere from 7 in the morning to 5 at night. I'm a texter, so you'll probably get some text from me. That's
All right. How many people do we have in shared living right now?
So right now we have 105 shared living providers. I'm hoping soon it'll be 107 because I have some people who are in the beginning stages, emergency respite, trying to make sure it's a good fit. And some of the shared living providers, they do have 2 individuals. That's an option too, later on down the road. I think we try to give it at least a year as a shared living provider before we offer a second placement. So yeah.
Okay, and what area do you cover? You cover Rutland County?
Yeah, we try to keep it within Rutland County. We do have some cases where it does kind of go outside of Rutland County. And there is a way to kind of do like the surrounding areas of Rutland County. So like Granville, Whitehall, stuff like that. Anything that borders the state, we can work with some people there too.
Okay. Can we talk about like some of the supports that are available for individuals that are under our services?
Yeah, so if you become a shared living provider, a lot of times, probably I would say 98% of the time, there's always going to be a respite budget. And what that looks like is you as the shared living provider, you become the employer, and we work with a company called Eris Solutions, and you would train a family member even, or somebody that's a close friend, and they would basically, when you needed a break or vacation, the individual would go stay with them, and there's a set budget, and then you basically make sure that all the paperwork's in order, trainings, things like that, training the person on the individual. Also, there's community support. We have contracted community support, and we also have community support through the agency. Basically, what that looks like is making sure that the individual gets out in the community, shopping, bowling, pickleball, basketball, things like that. Try to be active in the community. And then we also have employment supports, which is through the agency. And they'll have career developers, which help them start a resume, look for jobs, help them with the interview process, and then from there, we have DSPs, which is direct support professional. And what they will do is they will bring them to the job. Some of them will support the individual on the job. Yeah, that's...
Okay.
So in order to get the services, we have to do what's called a needs assessment. And then a needs assessment kind of determines what services an individual is eligible for. So like Josh was saying, if somebody has a job, we do a needs assessment and we determine if they need one-on-one support at their job, and if they need transportation to and from work. If they need community supports, we also, again, try to figure out, can they do contracted through Eris, or is it something where we need to hire a staff from our agency to provide that service?
Can either one of you add anything about the community room, how that's a resource for some of our individuals?
Yeah, absolutely. So we have a community room, and basically they do a lot of different things in there. They have card sharks, which is just playing card games.
They love Uno.
Yeah, Uno's a big thing
Uno's a
in
big
the
one.
community room. They do bingo,
They have a bake sale.
bake sale. Is that once a month or weekly?
It's once a month with the bingo, and the proceeds from that are used to help other individuals if they aren't able to afford different resources.
Yeah. Bowling program. Well, it's not really a program, but they go bowling twice a week, I believe, sometimes. And basically, the community room is designed to get individuals out and mingling with each other, doing activities together with their peers. Once in a while, ARC will put on a dance.
Yes.
And those are always awesome to see. So that's what the community room.
Okay, can we talk about like the individuals as far as like some of their needs are more than other individuals, where some individuals, they can go out into the community and they're able to access it without, any help. But then there's other ones that do need like, a shared living provider or some type of support to be with them if they wanted to engage in some type of activity.
Yeah, so we have, disabilities can range
Yes.
from not too difficult to very difficult. I would say the most, I don't know, maybe 60% is probably higher functioning. We do have some individuals who require 24/7 supervision because of behavior things, history. We do have some individuals who just are full medical care. So, it's 24/7 tube feeds, things like that. So it's what I try to do is look at what your background is, what your abilities are, what your lifestyle's like, and we always try to make sure that the fit is good.
Okay. The ones that are higher level, can we talk about like having like a registered nurse on that
Yeah, so
piece too?
So we have nurses, and they'll be part of the team. If there's any special care procedures, anything like that, they would train you on those. They come to the monthly meetings. They're also always a resource. Like if you ever had any questions, anything concerns, you could always call them, contact them. So yeah, we do have registered nurses for support with the higher medical needs.
Okay. Kristen,
Yeah.
how about discussing the part of where everyone is a team, where we all work together and there's
Sure.
good communication so that there's good continuity and quality of care?
Sure. Our individuals, when they come through, typically they come through our intake team, and once they're through intake, we do a needs assessment. The needs assessment will determine what needs the person has and what services they will get. If they are eligible for community supports or employment supports, the employment team and the community support team will be a part of the individual's core group or their team, as you were saying. So an individual is assigned a service coordinator who is like a case manager. That's their contact and point person. And then based on the other services that they get, they may have somebody from community, from employment, they may have a nurse on their caseload. Some of our individuals, like Josh said earlier, may have guardians. And if they have a public guardian or a private guardian, that person's also a part of their team.
Can you also explain the role of the service coordinator and how each individual has a service coordinator?
Sure. Yeah, so a service coordinator is like a case manager, and they are the point of contact for that individual and for their guardian. or their shared living provider. So if an individual, like say they need a medical appointment, a service coordinator will help facilitate and call and make the appointment. They may go to the medical appointment with the person if they need that support. We have a lot of individuals that need help with housing right now. We've done a lot of applications for housing and economic services. We've done a lot of support with finding resources for food shelf. It really depends on what the individual has going on in their life, and we try to help support them where they're at.
Okay. Did you want to talk about why March is Developmental Disabilities Month?
Yes, so this is Developmental Disabilities Awareness Month, and it is about raising awareness for our individuals that have developmental disabilities, but also the work that we do with our individuals. Like Josh was saying earlier, there's a lot of care that we provide some folks, and it's very rewarding. Our individuals are so much fun. We do a lot out in the community with them, and the community room is really awesome. It's such a fun place to be, and just seeing our individuals out in the community thriving is really important. A lot of our folks have been kind of segregated and not really exposed to various people in our community, so we're just trying to make sure that they understand social cues and that they can get out and have peer-to-peer relationships as well.
Okay. Josh, did you want to give your contact information?
Yeah, sure. You can contact me, jwilliams@rmhsccn.org, or you can call or text me at 802-683-9104. And I look forward to hopefully hearing from some people.
And Lori, did you want to add anything before we come to a close?
I think I would just like to mention quickly, if someone is thinking about doing shared living, I think that there's a lot of misconceptions about really what that job is, and what it's like to have people come into your home. And I want to say, starting from, the introduction, the meet and greet, when you meet a person that could quite possibly be placed with you, you get an opportunity to meet them and talk about yourself, and you get to learn about them. And then there's a kind of like a period of time where there's maybe an overnight stay, so you really get to see people probably a little more in depth. And they also get to see you. I like how the agency is very careful and very wonderful about trying to find the best fit that they can for both the shared provider and the individual that's going to be living there. And even your home inspection, I don't want people to be afraid of having people come in their home and feel that they're being judged in any way. It's an organization that really tries to support good and healthy relationships. And so what they do is, if they find a good fit, they help you with all those things and all those questions that you might have. And that's the teamwork that Josh talks about. It's so essential, and you don't do this by yourself. You really do this with a whole community of people who have the same idea that you do, and that is to share your life and experience working with someone that really needs your help.
Absolutely.
Mm-hmm. And can you add like one more piece why you feel it's rewarding to be a shared living provider?
Well, it's very gratifying. Some people are just caregivers by nature, and you don't know that till you get a chance to take care of somebody, but it's a different kind of care. It's sharing your life with another adult and helping them find their way. And the best way to do that, I find, is to meet them where they're at and bring them along in the world that they live in, with the challenges that they have. And it feels successful, and it's a good feeling, a very good feeling.
All right, well, this is the close of our show. Thank you for joining us today, and have a good afternoon. Thank you very much. Bye-bye.